Hi guys, Dr. Pascal here with Spinal Health Distributors, and today we're going to be talking about using the Scoliroll. There are two types of Scoliroll. There's the lumbar Scoliroll and the thoracic Scoliroll. Now, indications are obviously the patient having scoliosis, so 10 degrees of lateral curvature with rotation as seen on X-ray. So let's go ahead and start by demonstrating the lumbar Scoliroll. So we'll pretend here that our patient has a left lumbar scoliosis. So we want the peak of the lumbar roll to be at the peak of the curve, so wherever the apex of the curve is on X-ray. Now most of the time, this is going to fit inside the fleshy part of the hip here, and the peak will hit L2, L3 automatically. So we're going to have our patient lay on our left side, and we're setting up a head support here for the patient. So the patient would do this on the floor at home. Now, things to pay attention for are obviously when the patient lays on the Scoliroll, we want them to be perpendicular to the floor. We want to avoid any rotation in the spine. So sometimes you'll see either slouching of the shoulder forward or rotating backwards. So we want to avoid that. We teach them perpendicular to the floor. And if the patient finds that it's uncomfortable on the low back or the hips, we can put something between the legs, such as a pillow or a block, to give them some support to prevent rotation of the hips and relax the low back as well. Okay? Other things to pay attention for are the head position. So if we have a fairly neutral head position, we want to protect this while the patient is lying on the dental roll. So in this instance, if we're looking for neutral head position, we want the middle of the eyebrows, the bridge of the nose, the top of the lip. We want all of that to be in line with the sternal notch, which we look at our patient here and we can see that yes, the center of her face is in line with the sternal notch. Now, if my patient had a large right head translation, so the head was shifted to the right in their standing posture, and we wanted them to traction their head left, we could simply give them a smaller pillow or less support at home so that their head translates or shifts left while they're laying on the dental roll. Then the other thing to pay attention for is to make sure a lot of times when patients lay on the roll, they're going to want to hike up that left shoulder. So that bottom shoulder, we want to keep that in a fairly neutral position. Okay? When it's time to get off the dental roll, we have our patients lift their hips and they slide the dental roll out and they rest on the floor for a minute or two before getting up because the stretch can be quite aggressive. So let's go ahead and show you guys now how to use the thoracic dental roll. So now we have a patient laying on the thoracic dental roll. So the thoracic dental roll, obviously again we want the peak at the apex of the curve, and here we see the tip of her shoulder blade. The peak of the dental roll is slightly below the tip of the shoulder blade, so here it would be about T8 or T9. The same principles apply. We want to make sure that the patient is perpendicular to the table. We don't want to see any rotation in their spine. And again, we can see from behind, we're supporting the head in a fairly neutral position here. If the patient is sore while lying on the dental roll, at first, we can cover the peak of the dental roll with a bath towel. So I'd put a bath towel over top of the dental roll to ease the discomfort for the patient at first, or sometimes I'll even have them put an ice pack on top of the dental roll. Okay. Contraindications are your typical red flags. So things like fractures, instabilities, infections, or worsening of the patient's existing symptoms. If any of those things occur, I have the patient stop and then check back in with me. If you're uncertain exactly where to position the dental roll or if the dental roll is appropriate for a patient, we can simply do a stress x-ray. So we would set up the patient just like this in front of our x-ray machine, and we could take an x-ray of the patient lying on the unit to see the exact result or see exactly what we're getting. Every single unit has a time card. So we want the patient to build up to 20 minutes daily. Now every single Scoliroll comes with a time card just like this, and it gives a time progression so that we can get the patient built up to 20 minutes every single day. If you have any other questions or you'd like more information about the Scoliroll, please feel free to contact us.